Our next question is, why do we need a mandatory COVID vaccine when cases are on the decline?
Yeah, this is a really good question. It makes sense that if we're seeing a decrease in cases, that why would we still put a lot of resources into making a vaccine? And the reason is there are a significant number of people in our population that are considered high risk for catching COVID. So, for example, people with COPD or asthma or emphysema, and those people, if they were exposed to COVID, run a much higher risk of severe complications or even death if they were exposed to the actual COVID disease or virus. Whereas if we have an immunization for them, they do not have to be exposed to the actual disease. They're being exposed to the immunization, which is a very weakened form or even inactivated form of the disease, and they'll still build the same immunity as they would if they were exposed to the disease without putting themselves at increased risk.
I agree with that, and I would add that first, the reason we're seeing cases go down, particularly in some areas, is frankly some of our interventions around social distancing and masking are working, and that's a good news. That's good news. We do not know yet what the future case impact, especially as schools get started up again and we get into fall and winter, what may happen as far as that goes. The other thing that we don't know is that even if we do develop a good vaccine and develop antibodies, or let's say you even have catch the illness and develop antibodies, we do not know how long those antibodies will last. And it is very possible, I don't know for sure because we're learning every day about COVID, this could become an annual thing. We could in the future have cough and cold and flu and COVID season, that we are coming into, and we need to prepare and immunize people. So it is a possibility that this will not be a one and done vaccination and now I'm protected forever. This is the coronavirus. There's a lot of subtypes of the coronavirus, and it is possible that future infections could occur. So I think vaccination is probably going to still be important, especially for protecting the vulnerable amongst us.